Good afternoon. My name is Miriam Aliso from the Center for Parent Information and Resources, and I welcome you to this webinar, Return to School After Traumatic Brain Injury. This webinar will describe traumatic brain injury in children, including the prevalence, effects of the injury in children, models of care for children, and return to school for children following the injury. Our presenter today is Juliet Haarbauer-Krupa, Senior Health Scientist, Traumatic Brain Injury Team from the Division of Injury Prevention, National Center for Injury Prevention and Control, Center for Disease and Control and Prevention, CDC. Welcome, Juliet.
Oh, thank you very much. And hello, everyone. I'm very honored to be able to talk about this topic, which has been a passion in my career for over 40 years. So that does age me. But I want to share with you some insights that have come up recently in recent years. So I'm going to talk about what is a traumatic brain injury, a little bit about the prevalence and epidemiology, what we currently know about TBI in children, the effects of TBI in children, and return to school following a TBI. So first I'll say, what is a traumatic brain injury? Well, it's an injury that affects how the brain works, and it can be caused by a bump, blow, or jolt to the head, or a penetrating injury. And typically, they're classified as mild, and concussion is considered a type of mild TBI, moderate TBI, or severe. There's a Glasgow-Coma scale that folks use when they first diagnose it, especially if children have gone to the emergency department. I'll talk a little bit about the prevalence. So at CDC, we do something called surveillance, and we collect and report TBI data to understand who's affected by this injury, the leading ways a person may get it, and whether programs to prevent TBI are working. And this is our most recent surveillance report. We've also talked a lot about emergency department visits. So all the TBI surveillance information comes from hospital data, but we also looked at national surveys. And I published an article in 2018 based on the National Survey of Children's Health, where parents report if their child had a history of traumatic brain injury in the US. And at that time, we learned that 2.5% of all children in the US have a history of TBI. But we also know that not all visits for mild TBI and concussion are in the emergency department. This was a study done by Children's Hospital of Philadelphia, where we learned that the majority of people went to their primary care to get when they experienced a concussion, and there is no data, so we're missing these people. And also looking at models of care for children. Children and their families experience two models of care for concussion TBI. One is the healthcare setting, the emergency department, concussion clinic, pediatrician, and one is school. And there are different models of care. And what we identified in the paper that's referenced is there's gaps because these are different models of care. And I wanted to show you this to show you how TBI is identified in each of these systems. So in healthcare, the healthcare provider makes a diagnosis. Some children are seen by other specialists, and in some settings, the athletic trainer makes the initial diagnosis. Whereas at school, schools rely on parent or student report, or teachers or someone has observed the TBI at school. So totally different ways of identifying. But you see at the bottom, this happens especially in school. The event occurred, the TBI occurred, but the parents did not seek medical care. Excuse me. And sometimes teachers notice the child comes back from the weekend and they've changed in their behavior. So teachers are very good reporters of these changes, but they don't always know that it was because of a TBI. So how does TBI affect children? Well, what we know over the years since I started imaging has really changed, and they don't always image children who experience mild TBI, but we've learned so much about the brain. We've also learned about injury mechanisms. As you can see, kids fall, but a lot of the attention right now is on sports-related concussion. However, there's multiple injury mechanisms. And I did this graph in collaboration, again, with Children's Hospital of Philadelphia, where we looked at, over time, what kind of injury was occurring. And as you can see, in the younger years, 0 to 5, it's mostly falls, so it's non-sports related. And sports-related injuries start to increase around between 6 and 8 when children are beginning to engage in sports. And as they get into adolescence, that is, from what we've seen, one of the primary mechanisms of injury. An age of injury means something. So it used to be that people thought, well, if young kids get an injury or babies, they'll be fine. But what we're learning based on some short-term studies is that younger children are really at risk for longer-term effects. So we have to make sure we monitor and take care of them. We also know that past and current health history means something. So we learned on that other paper, children with a lifetime history of TBI are more likely to have co-occurring health conditions, such as learning disorders, speech and language problems, ADHD. So some of these are observed in school, and children might be placed in a different category for special education, but truly, the origin of these is the traumatic brain injury. And the other thing we've learned is it's very heterogeneous. So when kids experience an injury, the effects and outcomes are related to what happened during the injury, individual child characteristics. Children who are struggling in school before the injury may continue to struggle in school after, and the child's home environment and family environment. And what we know about adult outcomes, and this is from our report to Congress on the management of TBI in children. We want children to graduate, get a job, and have a good quality of life. But unfortunately, right now, the most we know about TBI outcomes in children is there's a very high rate of self-reported childhood injury in the justice system. Between 50 and 70% of individuals in the justice system have had a childhood brain injury, and we don't want kids to go there. So we have to work to make sure we take care of them. Children also have a lot of transitions. They have transitions from preschool to kindergarten, from middle school to high school, and then they become an adult. And what happens with TBI, because it's an unexpected event and parents and students, children aren't always aware of the long-term effects, when they go to transition to an adulthood, unless they're enrolled in special education, there's really no plan for them about what to do and how to manage their health. We're working on that. And I wanted to share this with you. So this was released in 2018. It's a report to Congress on the management of traumatic brain injury in children. And the co-authors are Dr. Ann Glang, who is an educator, Dr. Brad Kowalski, who's a physician, and my team lead and I, Matt Briding. And what we really tried to do in this report is examine TBI across the lifespan and look where the gaps are. This was mandated to us by the TBI Act of 2014, and we released it in 2018. It's on our website. But really, what we did in this is we identified gaps in healthcare, school, and community services. We highlighted policy strategies to address both the short and long-term consequences of TBI, and we tried to offer specific and actionable recommendations. So you'll see, this is our key words for this. We need to recognize TBI in children, monitor them over time, and take care of them when they need care. We want to make sure, especially in school, that they're monitored and train educational professionals, understand the transitions, And also there's a real need for longitudinal studies in children to better understand the long-term effects. Recently, there's been a lot of work done about TBI as a chronic health condition in adults. I have colleagues who have federal funding to develop a model, and this is the World Health Organization, of what it means to be a chronic condition, which fits with what we're noticing based on the research in children. But research is emerging on the long-term effects in children, indicating that TBI can remain over the child's lifespan into adulthood. So there's more studies are reporting on moderate to severe TBI, where they look back retrospectively based on adult data. But they are seeing effects from this. And some of the effects, adults who report a childhood injury report post-TBI health and behavioral changes that result in financial and emotional challenges. So, return to school after TBI. We want all kids to go back to school. And as I mentioned to my colleagues when I first started, children are in the healthcare setting for about 5 minutes. They're in school the rest of their lives. So that's where we need to concentrate on making sure they're getting care. So here's some promising practices that we learned from an initial project we did to better understand where return to school is happening. And from this project, we learned that there's return to school programs in both healthcare settings and schools, and also in some state agencies that do case management for children after TBI. But we learned these are very promising practices: encouraging parent involvement, sharing materials and ideas about return to school, partnering with academic institutions and other TBI stakeholders, and using evidence to form policies and practices. So I put up here, this is an overview of all the policies and legislation related to traumatic brain injury in the schools. So one is return to play and return to learn laws, and 50 states have return to play laws. About 8 to 10 states have something called return to learn laws, which is associated with return to play. And the reason this was started is that most children who experience mild TBI or concussion stay in the general education setting. Another area is the school nurse, who can write a school health plan for children coming back to school. And lastly, we have under IDEA, traumatic brain injury is considered a category under IDEA. And children can be qualified for special education, or they can have 504 plans. Interestingly, over the years, the TBI category under IDEA has been low in numbers. So people consider that this is not a high condition, it's a low incidence condition in special education. But as we know, there's lots of concussions and a lot of kids need served when they come back to school. So I want to share with you a little bit of the resources for schools. We have, this is through our Heads Up campaign. We have a page that explains symptoms and basic recovery tips. We also learned that taking letters from the healthcare setting to schools better inform educators about what to do. So we created a form that parents can take to the doctors and ask them to complete for returning to school. We also have several training sessions on our website that are free, including for educators on concussion in children. So it's free training. You just go to our website and you can take the training. We also have training for healthcare providers on concussion in children, and also for athletic trainers and school professionals. So we're trying to address multiple disciplines to get training done to help kids get back to school. Also youth sport coaches, high school sports coaches, and more recently, sports officials. So we're trying to get the word out, and our Heads Up campaign is in this year is the 20th anniversary. And I know that the parent education system has our older materials on, our new ones are just now coming out, and we're very proud of this work. So in summary, what I want to say is children experience TBI and concussion across the age span of childhood, and they navigate two models of care for the children, healthcare and school systems. What we know is that children can experience long-term effects over their school career and into adulthood, which really makes us need to monitor them over time after a TBI or concussion. So my main point today is TBI is not just an event. We want to make sure that children who can possibly have chronic effects from it are taken care of. And this is the message I want to leave you with. We need to recognize that a concussion and a brain injury occurred, monitor children over time, watch their behavior, and take care of them when they're showing issues that need addressed. So this is my email. I want to thank you all very much. You are welcome to contact me at any time if you have questions.
Please share this information broadly with the families you serve. And if you have any questions, please contact Carolyn Hayer, the CIPER director. The email is here. And thank you for attending this webinar.